Welcome to the another video of Histopathology and Cytology Techniques Unit 1, V-2, Histopathology. Types of microtomes. Microtomes are precision instruments used to cut uniform thin sections of biological specimens for microscopic examination. 1. Rotary microtome. Most commonly used in histopathology. Ideal for paraffin-embedded tissues. Section thickness, 150 m. 2. Cryostat, freezing microtome. Integrated with a freezing chamber for rapid sectioning of fresh or frozen tissues. Used for intraoperative consultations. Section thickness, 540 m. Maintains tissue integrity and enzyme activity. 3. Sliding microtome. Suitable for large blocks of tissue, e.g., brain. Used in research. Manual operation with sliding knife. 4. Ultramicrotome. Used for electron microscopy. Section thickness, 5100 nm. Uses diamond or glass knives. 5. Vibrating microtome, vibratome. Cuts unfixed tissues or thick sections without embedding. Useful for neuroscience. Types of microtome knives. 1. Steel knives. Standard for paraffin sections. Can be wedge, plane concave, or biconcave. 2. Glass knives. Used in ultramicrotomy, for electron microscopy. Brittle but give very fine sections. 3. Diamond knives. Extremely durable and precise. Used for ultra-thin sections in electron microscopy. Knife sharpening procedures. Honing. Carried out on a fine abrasive surface, usually glass or leather with alumina or carborundum. Removes nicks and gives a sharp edge. Performed at a consistent angle. Stropping. Final step using leather strop with strop paste. Polishes and aligns the edge. Prevents tearing of sections. Decalcification of bone. Decalcification is necessary for cutting sections of calcified tissues like bone. Types of decalcifying agents. 1. Acid-based decalcifiers. Strong acids, nitric acid, hydrochloric acid. Weak acids, formic acid, acetic acid. Fast but may damage tissue morphology and stain quality. 2. Chelating agents. EDTA, ethylenediamine tetraic acid. Slower but preserves cellular structure and staining. 3. Ion exchange resins. Enhance decalcification by removing calcium ions. Used in combination with acids. 4. Electrophoretic decalcification. Uses electric current to accelerate ion movement. Experimental use. Endpoint detection can be done by X-ray, chemical tests, calcium oxalate test, or physical testing. Flexibility. Mounting media. Used to preserve stained sections and enhance microscopic viewing. 1. DPX, diastyrene plasticizer xylene. Synthetic resin. Non-aqueous, used after dehydration and clearing. Good for permanent mounts. 2. Glycerin, or glycerol. Aqueous medium. Used for temporary preparations or enzyme studies. Useful for mounting unfixed or frozen sections. Record maintenance and chart preparation. Accurate documentation is essential in histopathology labs. Steps. 1. Case record keeping. Patient ID, clinical history, specimen details, tests performed. 2. Sectioning logs. Include date, type of microtome used, section thickness, and block numbers. 3. Staining records. Stains used, batch numbers, timings. 4. Investigation charts. Tabulated format showing test names, findings, interpretation. Include controls and quality assurance data. Charts can be digital or hand-drawn, depending on lab infrastructure. Standard formats help in audits and quality control. MCQs. 1. Which type of microtome is used for frozen sectioning during surgery? A. Rotary microtome. B. Cryostat. C. Sliding microtome. D. Vibratome. Answer, B. 2. Which microtome is used for cutting ultra-thin sections for electron microscopy? A. Vibratome. B. Rotary microtome. C. Ultramicrotome. D. Sliding microtome. Answer, C. 3. The most commonly used microtome in routine histopathology is A. Vibrating microtome. B. Sliding microtome. C. Rotary microtome. D. Freezing microtome. Answer, C. 4. The thickness of sections cut by a cryostat is usually A. 0.11 m. B. 13 m. C. 540 m. D. 100-200 m. Answer, C. 5. Which microtome knife is most commonly used for paraffin sections? A. Diamond knife. B. Glass knife. C. Steel knife. D. Ceramic knife. Answer, C. 6. Which of the following is a strong acid decalcifying agent? A. Formic acid. B. EDTA. C. Nitric acid. D. Acetic acid. Answer, C. 7. Which decalcifying agent is best for preserving cellular detail? A. HCl. B. EDTA. C. Nitric acid. D. Formic acid. Answer, B. 8. What is the function of a strop in knife sharpening? A. Grind the knife edge. B. Clean the knife. C. Polish and align the edge. D. Measure angle. Answer, C. 9. Which mounting medium is synthetic and used for permanent mounts? A. Glycerin. B. Canada balsam. C. DPX. D. Agar. Answer, C. 10. Which mounting medium is aqueous and used for temporary slides? A. DPX. B. Cedarwood oil. C. Glycerin. D. Xylene. Answer, C. 11. What is the usual thickness of a paraffin embedded tissue section? A. 50-100 nm. B. 110 m. C. 50-100 m. D. 100-200 m. Answer, B. 12. Which method helps in detecting the endpoint of decalcification? A. Visual observation. B. Knife sharpness. C. Calcium oxalate test. D. Freezing point test. Answer, C. 13. Which microtome is best for cutting large brain sections? A. Rotary microtome. B. Ultramicrotome. C. Sliding microtome. D. Vibrating microtome. Answer, C. 14. In which sharpening method is an abrasive surface used? A. Stropping. B. Honing. C. Heating. D. Grinding. Answer, B. 15. Which of the following is a chelating agent used in decalcification? A. HCl. B. EDTA. C. Nitric acid. D. Acetic acid. Answer, B. 16. What is the purpose of record maintenance in a pathology lab? A. Decoration. B. Forensics. C. Quality control and audit. D. Billing. Answer, C. 17. Which of the following is not a decalcifying agent? A. Formic acid. B. EDTA. C. Xylene. D. Nitric acid. Answer, C. 18. Which type of knife is used for cutting ultra-thin sections? A. Steel. B. Diamond. C. Ceramic. D. Plastic. Answer, B. 19. What is the main advantage of using EDTA over strong acids? A. Faster. B. Cheaper. C. Preserves morphology. D. More abrasive. Answer, C. 20. What is the clearing agent used before mounting with DPX? A. alcohol. B. Water. C. Glycerin. D. Xylene. Answer, D. Thanks for watching. If like the video, then subscribe the channel and don't forget to hit the bell icon to get latest update. Stay dammy.